Let's go beyond the connection. Welcome to the podcast. I'm Steve McConnell, your host, and we're on with a very special guest today, Julie Dearinger-Smith. Now, Julie, you are best known as founder and CEO of your own company, Contingency Health Systems. But what I want to talk about before we get started here is a little bit more of your background, because I think to understand your background is to understand why you are the expert to talk about how can we take tech and have a much larger, broader seat at the table of decision making that's happening at businesses and why. That's what we're going to be talking about today. But from your humble beginnings as a farm girl in Kansas and waking up and taking care of livestock, you were a nurse for over 25 years and you moved into healthcare, out of that, healthcare into HR and consulting, and now you have your own consulting practice. And now you talk and you have your own technology applications that you've created, and you talk on network resiliency, and specifically in the healthcare industry is your niche. But I might have just taken every bit of thunder from you, but if you wouldn't mind explaining just maybe a little bit more about your background before we get started.
I'd be happy to. So the company is Contingency Health Solutions, and absolutely can find us on social media and all that. But let's start a long time ago. As you said, I've been a nurse for about 25 years, in healthcare even longer than that. And I've been in informatics, which is my nursing specialty, for the last 20 years. It's hard to believe, time flies. And really, when anybody that's been in nursing informatics for as long as I have, most of us have the same story. We just kind of tripped over our own 2 feet and found ourselves in informatics. That was really at the beginning of when it was becoming a specialty. That was my niche. That is definitely where I found that I had a place, and my brain works the way you have to have your brain work in IT, or just wired a little bit different. And so love that. After a few years of being in informatics and supporting a health system, actually I was hired on by the EHR company that I had supported their product, and they had to come on and started clinical consulting. And I loved that. It was really project management. So we worked with hospitals that may not have had their own project team, and we went in and we managed the clients, the hospital's team, when they did implementations of applications or EHRs. And that very quickly was successful. And so I started managing the team of project managers and got to travel all over the country and work with so many health systems. So interesting how every health system is just a little bit different, but that was a lot of fun. But after the fun, I found I was ready to go back to a health system. And so I returned to health system as an IT director for a health system down in Pensacola, Florida. But most recently, I have, as you mentioned, started my company, which is Contingency Health Solutions. So we focus on business continuity planning. So if you plan for a crisis, it's no longer a crisis. Hopefully, it's just an inconvenience. And then also, as you mentioned, have a couple of applications that are now client ready. So we're working and talking to some health systems about implementing those so that they're going to be prepared in case anything happens to them.
Well, great. You know, having your tech, your nursing background kind of combined, the broader topic here is how tech can have a larger seat at the table. And that's an issue that's a problem outside of just healthcare. But my goodness, in healthcare, the access to our data, to our networks, the resiliency is life dependent. So it takes on a whole new level. So it's almost surprising that at that whole new level, that data matters inside of the healthcare industry, that tech doesn't have a seat at that table. I mean, just tell me a little bit about your experiences and why this was a topic that was passionate for you.
Yeah, I have several passions. I know we're going to talk about a few of those. I think every health system's different. As I mentioned, I've been around the country. I've seen a lot of health systems. Their structure is different. Some CIOs do have that seat at the table, that C-suite table or executive leadership table. Some do. And I've got a few stories about that. Some don't. And, technology is so central to not just healthcare. This is really broader. Technology is everywhere. It touches every part of every business. Even a person that has their own business, maybe it's a service business, they still use technology to communicate with clients and find clients. So whether it's your day to day, but most of the time, I mean, if you're a large enough health system that you have a C-suite and a CIO, then it's definitely going to touch every piece of the business.
So how now do we merge this with the fact that it touches everything? And if it touches everything, then it's germane to everything from the patient experience to internally how we interact, how we gain data to make decisions. So why is there this issue that tech, then all the way to then bottom line performance and revenue for the organization? So why is it an issue? I'm trying to understand, like, why is technology not always at the table? It's so important to the overall operation.
It is. It is so hard for us to understand because we are in technology and that's what we do every day. I think part of it is the communication. Sometimes it can be daunting to understand technology because it is so complex. And previously, if you look at CIO role, it hasn't been around for 50 years. It's a lot younger than that. When it first came into existence, it wasn't in every piece of every business. It's grown. Technology, especially now, is evolving so quickly that it's become even more important. So I think some of it is intimidation. I think it's intimidating to start thinking about the complex system and to say, oh, I just don't speak that language. But the CIO is there because they speak the language of technology and they speak the language of the C-suite. Speaking that and being able to be a translator in the middle.
I think that's a really important point you just made. You get somebody at that level finally in the organization, and they can speak from a tech and a business perspective. Because when we're part of the C suite, we definitely have to talk about KPIs of the business. We have to understand what's important strategically for the business to grow and not just network resiliency, how we're sharing and accessing driven data. But what's really interesting is, as much as we're talking all about tech here, you talk a lot about people in tech and how important that is. And I wanted to give you a chance to talk about that a little bit.
Yeah, team culture is so important. Team building is so important. Culture is important. That culture of communication and working together. Everybody has to work together to really be a cohesive unit. So it's important to me. I actually later this year hope to have a book out that I'm putting the finishing touches on. It's called Building Your Leadership Legacy, and it's a framework for team member development. At the C level, generally, you're not doing individual team member development, but it is that culture of communication and education and feeling as though you've got this team of executive officers that you can be open with and be able to have those tough conversations. Some conversations are difficult to have, but from a strategic perspective, you said strategy, and that is so important because it's not just the operational. There's so much about technology we can talk about. And I think a lot of times, why does a CIO not have a seat at that executive level is because they think of IT and the CIO as an operational day-to-day job and not necessarily looking strategically in the future. So let me use this analogy. Imagine that you have an electrical grid, okay? So that electrical grid for a city, you have that electrical grid, and if you don't know how the city is going to grow and expand, and your electrical grid isn't growing, expanding to support that infrastructure, if the infrastructure isn't there, then you're going to start getting brownouts and blackouts because you have not planned to grow the way that the city is growing, the way the business is growing. So you have to be at the table to know exactly where we're headed and how we can help and how we need to build that infrastructure. Because if you're trying to catch up after the plan has been set, you're already behind.
Makes perfect sense. So here's what I'm thinking is this idea of culture and team performance and network performance. Bridge that for me here a little bit. What's the learning? What's the takeaway that you want us to have in terms of this kind of conversation and how those two intersect and align and overlap?
Yeah, so you have to work together and you have to have a vision and you have to have a strategy. So the technology is only as effective as the vision behind it. And that's the people and the leaders working together with the clinicians, with the end users, with the CEO, with the COO. And the best technology out there, it's completely useless if it's not adopted. It's a waste of money. So you also need the people to work together to make sure that the adoption is there, that it's being used as it should be, and also understand that technical issues are going to happen. It's the part of life. So it's inevitable. So you have to be working as a team to resolve those technical issues, whatever they may be, and work that out so that it's a little bit smoother. But it's collaboration across all disciplines. We could talk about disciplines in IT, as in I've got middleware and I've got my server team. But ultimately, what's true, you have to work together in that way. But it's also collaboration across the organization for everybody who's using that technology.
Now, you started out and you talked about like your company was about network resiliency, and that's your consulting practice is built around that and the plans for not only how do we maintain resiliency, but how actually, if we don't, the network goes down, what do we do? So if you could kind of in healthcare, not you don't have to name any one organization or anything, but in healthcare, just paint the picture of network resiliency and like how many times do networks go down? Paint the challenge for us if you could.
Well, I think there's some stats, don't hold me to this, but there's something like 1,400 cyber attacks happening every week across the globe. Some of them are, I don't want to say successful because you don't want them to be successful, but some of them are more operationally disruptive than others. But it's constantly happening. I was just talking to our CTO the other day, and he put a Raspberry Pi on his network, and he said immediately, every country, he had people trying to attack it to get into it. So let alone somebody like a health system that is very, I don't want to say it's a target rich environment, but you do have protected health information along with system stability and operational stability. So they are a target. As far as how do we be resilient? I'm going to go down a couple of things that I'm not going to get too deep into this, but I think you've got your segmentation. So you want to segment off some of your solutions and some of your systems. You also want to have resiliency. What kind of disaster recovery do we have? How do we have backup systems? How do we have backup connections so that if one goes down, we don't all go down? And it's also partnering with the people who do this every day, all day. So finding a trusted partner, finding that consulting group where you can partner with them, you can trust in them, understanding that you don't have it all covered. Beware of the CIO that says we are completely safe and resilient and we have no concerns. Beware of that guy. So you have to understand that there's always room for improvement. That's part of resiliency as well. And even the smartest person in the room is going to be able to learn something. Nobody knows everything. And that comes back to that team working together to make sure that we're looking at this from all angles.
So it's interesting because now I'm piecing together the culture of part of this even more because you started talking about working with partners because it's hard. The technology is changing every day. Every day. There's cyber attacks, there's patches, there's things that are happening. There's no way any of us could keep up. And I talked to a lot of folks that are like senior IT people in their organizations, and they rely very heavily on their partners to help keep them up to speed. And so I'm just going to ask that culture that you're talking about here, I would imagine that extends out to the partner network that you have to have. That'd be a good, true statement.
It is. And it's about trust. It's about more than just transactions. It's about having those partners that you're going to work with that you have an immediate go-to. Who do I reach out to when I have a concern? Also, as you get into the preparedness of tabletop exercises and what kind of drills are we going to have, those are those partners. They're going to be a part of that as well. So I was at HIMSS a couple of weeks ago and went to this great cyber exercise. And I'm going to share it because everybody that was in there, very, very similar to me and my experience from a length perspective. I think everybody in there is probably at IT for at least 15 years, not 20, and brought a different scenario than I had ever considered. And that was the FBI walks into a hospital and says, "We found this on the web. We believe that you've been compromised." And it turned all of us around a little bit as we were going through this exercise that was put on because none of us had ever considered that. And that's why you want to get these partners that you can bring in that have seen so much more than just one health system has seen, so that you've got that partnership and then they know who else to bring in. So that was really interesting. That was a big takeaway for me.
So another thing that you said towards the very beginning is that in your company, you're developing applications. And one of the most important things of network resiliency is access to our cloud applications. And the analogy I always think is like, how many applications just on our phones are we dependent on? Like we can't live without them, let alone now in business. In healthcare is no different. How important is access to our cloud applications in this resilient network in terms of like the hierarchy, the priorities of what we're trying to protect and what we're trying to have access to cloud applications? How important is that in the mindset of the people that you're working with every day?
Extremely important. And to clarify it, I've taken a little bit of a different approach than some people think about because what I am developing is what do you do and how do you care for patients when your network is down for an extended amount of time? So it is different than we can talk about resiliency. We've got a plan so that doesn't happen. But ultimately, we all see in the news every day it still happens. So plan for that. As far as having your applications in the cloud, you could have a debate what's better on prem or in the cloud. Ultimately, if your network comes down, you don't have access to those. But part of this resiliency is understanding what applications are in the cloud, which ones you will have, which ones you won't have in case you are a target of a cyber attack, of a successful cyber attack. So it's taking an inventory of all of those things and then understanding which ones are going to be the most important to bring back up if you do lose them, or which ones are the most critical to protect and which ones are at a higher risk. All of that is part of partnering with the right people and bringing in your vendors that you're working with to make sure that you've got a second set of eyes on that, where you can't free your own paper.
So you're stack ranking, you're prioritizing the applications in terms of their critical nature to the healthcare organization. That makes perfect sense. So there's so much complexity in a network and the infrastructure and the technology. How do you communicate complexity in simple terms so that this culture, the teams, internal and external, we're all marching together? I mean, misalignment across organizations, not just in healthcare, not just in technology, is a big deal. But these plans that you're putting together, that's a part of the complexity, like organizing the complexity from when we're down or keeping us up. How do you communicate complexity in simple terms?
So everybody has a few mottos, a few sayings that they live by. And one of the things that I've said ever since I've been in IT, at least, is if I can't explain it simply enough, I don't understand it well enough. So I think you don't want to oversimplify it because it is complex, but you also need to speak the language of your audience. I've been a translator all of my career. So initially, when I was at the bedside, I was a translator between the instructions and what they needed to know and them. So I could translate that to the patients. I had to understand both languages. As I moved into informatics, and what I've done for decades is I'm the translator between the clinician and technology. I understand both of those worlds and how to talk and how to explain it in a way that makes the most sense. The CIO does the same thing when it comes to that C-suite, is they have to be able to explain it simply, whether it's analogies, whether it's diagrams, but in a way that is easy to understand, and they can absolutely do that. That's why the CIO role, one of the reasons why the CIO role was developed. Talking about a seat at the table, I wanted to tell you this story, and I haven't gotten to it yet. So again, this was at HIMSS, and it was a gentleman that was actually in that same cyber exercise with me. The next morning, we ended up sitting at the same table, and he was always like to hear about journeys. He's a CIO, and where he's from and where he came from, his background, and where he's going. And he said that he's actually he's CIO, and he's starting to look forward to his next steps. He's been in his role for 5 or 6, 7 years. And I asked him where that was. And he said, an answer I have not gotten before. He said, well, I'm really looking to move over to the financial strategy vice presidency. He said, that's just his niche. That's what he loves to do. And so that's where he's looking to move next. So I asked him about his current role. And he said that when he had first applied for this role, CIO role, they offered it to him. And he asked them before he accepted if this was an C-level position. Were they with the executive officers at that table? And at the time it wasn't. And he said, I can't accept this position because it seems that you don't understand the importance of the CIO, because it touches every piece of the business and it supports every piece of the business, current, forward, strategy. So I'm afraid unless it is at the C-suite, I am not going to be able to accept. They took that away. They thought about it and they said, you're absolutely right. So why was his position not in the C-suite? Well, it just so happened that somebody wasn't able to explain it in that way until then for that team. So ever since he joined the CIO in that role, or the organization in the CIO role, he's been at the table.
It's such a great idea. You got to have a lot of confidence in your own career to turn down a position, but it literally underlines and puts an exclamation point on how important it is, and to have that seat at the table. So that seat at the table has to talk tech. That seat at the table has to talk business. The third thing that seat at the table has to do, they have to have a vision for the future and technology and where it's going. And it's more than just attending conferences, which is extraordinarily important, but it's having a point of view. And you mentioned earlier the idea of multiple connections, and a big part of the resiliency plan is we can't rely on one ISP. We have to have multiple ISPs coming in, and then that redundancy that you're talking about, the failover systems and things like that. There is a big trend that's been well documented. I just wanted to ask your opinion of the future, especially in the healthcare industry, because there are plenty of distributed healthcare offices and organizations in very rural areas where network infrastructure isn't like what it is in the major cities. How important are wireless connections in the healthcare industry for network resiliency?
So from a wireless perspective in healthcare, it is interesting because I could argue either way that we love wired connections. They're so stable and it brings a level of complexity out of that connection. But you really do have to have mobility in healthcare. So everything is connected anymore. It's the Internet of Things, and everything is connected. From the bed in the hospital is connected to wireless. Our patients are asking for different supplies and different services through their TV. So it's everywhere you go. And a patient travels through the hospital, and our nurses and our clinicians or our physicians, they travel through the hospital. You see them with wireless devices on them all the time. So it has to be resilient. It has to be really invisible. So I'm going to tell you a story about wireless. This goes all the way back almost 20 years. And I was supporting an EHR in a community hospital. We had a problem with the manual system, and we were wanting to bring physicians on, and the nurses were screaming about the issue with wireless and all the connections, and they would drop, and they were threatening to throw computers out the windows, which probably not an idle threat. Thankfully, the windows didn't open up much. But before we were going to bring on physicians, we had the discussion to say, we've got to fix this issue. We've got to make sure our wireless is strong and resilient. And we did. And the nurses didn't say anything. So the gentleman in the IT department that I worked with, they were like, how do you like that? The nurses didn't say anything about how the wireless is working. And I said, that speaks because unfortunately for the infrastructure team, your infrastructure is supposed to be invisible. And even now I remind my team members, make sure you're giving some kudos to the infrastructure team, because They're unsung heroes because nobody sings their praises when everything works, even though that's what everybody wants from them. When you walk in a room, you flip on the light switch and you just assume that the light's going to come on and you don't think twice about it until it doesn't.
Well, Julie, we have talked about so much here. I just have one last question for you. And that is, if there was a single takeaway that you wanted the audience to have from today's podcast episode, what would that be?
Let me give you a couple of points about that. First of all, you need to continue to work hard to be resilient. You're not resilient enough. Doesn't matter where you are in the game, you're not resilient enough. You need to keep pushing for better resiliency. You also need to plan. And when I say plan, I mean do an assessment, do drills, do tabletop exercises, and bring people in that have a different perspective that can share that with you, because you're going to learn something new with every drill, with every tabletop exercise. And the third thing is plan for the system not being there. And this isn't something IT has to own. This is operational. I know infrastructure people don't like to talk about downtime. Nobody does. But let's pivot for just a moment and say IT is at the table when they are talking about operational resiliency and business continuity, but they're not the main focus and they're not the drivers. The drivers are operations. How do we keep our service lines from going down when our network is down or when our application is down? It may not be the network, it may be a single application, but that's where we have to identify what are our critical applications and have we done everything to keep them resilient. And even if we have, plan for it. You've got supply chain initiative. We saw that during the pandemic. Some people, even now, years later, they still may have those if some of their systems go down. So just plan for it. So keep working hard, be prepared, and plan for what you don't want to have happen. I think I said earlier, if you plan ahead of time for a crisis, hopefully it will only be an inconvenience.
It's a good way to think about it. I think that right there could have been the single takeaway.
There you go. Maybe you have gotten me down to one point. Nobody's ever been able to do that.
Well, Julie, if people have questions, would it be appropriate if we gave out a link to your LinkedIn profile that people could reach out to you?
Yeah, absolutely. And you can find Contingency Health Solutions on LinkedIn. And also, if you go to the website, you'll find some information and you can ask for us to give you a call. info@contingencyhealthsolutions.com.
Fantastic. Well, thank you. Thank you for coming on. And your background is interesting. You gave a very unique perspective today, and I just really appreciate that.
Thank you for having me.